Hello, Montez. How are you today?
I'm doing great. Thank you so much for having me.
So, as a member of the American Hospital Association's Board of Trustees and board liaison to IFDHE, the Institute for Diversity and Health Equity's Leadership Council, you have a history of working with AHA on the importance of health equity. And you've been on the ground floor as a CEO of a hospital on your work around health equity and really thinking through our work with the health equity roadmap as well. Can you tell us a little about your involvement with the health equity roadmap?
Yeah, so we were very excited to be a part of the pilot project actually as we began having the conversations as AHA was developing the roadmap. And so our involvement was to first participate in the assessment of the health equity transformation assessment and to really try to better understand where we were on our journey and to understand where there were gaps and how we could then think through strategically how we could prioritize some of those opportunities that were identified so that we could continue to make progress in terms of health equity on the roadmap. So it's been a very insightful opportunity for us. We have 3 facilities that span about 15 counties in terms of our service area from our organization. And even when we think about equity and roadmap, I think one thing that we appreciated is that even though we are a system, communities are different. And so even though there were similarities, there were also differences on where our communities were on this journey. And it was great for us to start thinking differently about how we could continue in a very strategic and intentional way around improving our work in health equity.
That's great. Thank you. I'm going to pass it to Joy for the next question.
Sure. Good to see you, Montez. So in your estimation as a leader, what do you think will indicate if we as a field are indeed making progress toward becoming more equitable and inclusive hospitals and health systems?
That's a great question. And I think that whenever we begin to see less disparities and barriers that impact a person's ability to be the best version of themselves, then I think that that's when we can feel better in terms of where we are around health equity. And I think that one of the key elements of that is, first of all, having a better appreciation as an industry around disparities, what they are, how they happen, not from a point of blame, but to acknowledge that they exist, to acknowledge what the impact of them is on communities, and to have an appreciation that what affects the most vulnerable of us affects all of us. And I think that's one thing that COVID has taught us if we did not understand that prior to the pandemic. And so I think that as we begin to make progress on embracing, identifying, acknowledging, and addressing disparities, then we will be able to make progress on improving equity.
So one thing, I'm going to go back a little bit to your involvement, and I'm going to tie in your last comment with the health equity roadmap. Because part of the roadmap, what it allows hospitals, and you've had this experience, is of identifying the opportunities. Were there any specific opportunities in really looking at your own kind of behind the curtains that you would like to speak to?
Absolutely. I think that, in our industry, we've been talking about DEI for some time. And I think that as we begin to really pull that apart, one thing that we appreciate is that diversity, equity, and inclusion are different. They're different streams of work, but there's an interconnectedness of them as well. And so I think that from some of the work that we've done, particularly around diversity, we have seen some improvements. And when we looked at our assessment, we were able to kind of tease and validate some of that. But at the same time, as we look at how our improvements in diversity and inclusion can be combined with us getting more data, better data, to be able to really evaluate what are the gaps or differences in terms of our care processes and outcomes, that was an opportunity for us to look at equity and ultimate outcomes of equity in a different way. So we're not as mature in the outcome space in terms of our care processes and identifying where there are differences and opportunities. So I think the roadmap showed and validated where we were making a lot of inroads, but also what were some of those opportunities that we had. And there were a lot of opportunities identified without question, but I think that the roadmap lays it out in a way that we're able to not just identify those, but after identifying those, deciding how do we prioritize the work that we'll be able to continue to move forward with.
Great.
Can I lean into something Montez just said? Because the data, to your point, are clear that health disparities exist and have existed for an extremely long time. The pandemic may have illuminated some of that. I'm curious, we've heard from our members in the field test, actually, that you participated in, that learnings from hospitals' past efforts to improve quality and patient safety can actually provide some valuable lessons that we can apply to this equity work, kind of reaching back to our memory from how do we close the gaps, right, when we had quality and patient safety challenges, because now so many hospitals will proudly say they're providing high quality care, right?
Right.
What are your thoughts on kind of leveraging those prior experiences to advancing equity?
Yeah, I mean, you bring up a good point, and this weekend, I think one of the most insightful things, actually, Joy, during the session that you had on yesterday, one of the very insightful comments that was shared is that we cannot truly have quality and safety without equity. I mean, so I think that kind of the starting point is that equity, quality, and safety all go hand in hand, and they're actually intertwined. And so I think that there's some really good organizations that are more advanced in how we can look at the very scientific approach that we've taken in different ways, and then to be able to now kind of incorporate that in terms of how we look at equity, and to look at those organizations that have done a lot of great work really builds this community. And I think that's a great thing about the work that's going on with AHA. It's not just doing the assessment, not just laying out the roadmap, but also now creating a community of people that are committed to equity so that we can learn from one another, to either know what worked or what did not work. You know, because part of the work is to say that if we go down a path, we want to learn how to fail fast. But at the same time, if we go down a path and we begin to see positive results, that we're able to now come together and figure out how to share that and scale that, because once it's scaled, our communities are the beneficiary, of that work. I mean, all boats float whenever we learn from one another.
That's right.
Yeah, you bring up two things that we'll just put a plug in for, because we do believe that we need natural networks, and we also need really intentional networks to move this work. So we have the Health Equity Influencers Roundtable, which is a network of professionals who are the leaders or really in charge of or moving the needle for health equity at their organization by way of kind of formal title, meaning a chief diversity officer, chief equity officer. We also have space for those who informally are moving it, as a director of a task force or chair of a council. Then when we think about those kind of networks, the importance of those, I mean, you have benefited as a leader in those networks. Can you talk more about how those kind of professional networks, much like what we're doing today, have supported your career in this part?
Yeah, I think they're vital because everyone has a different lens around equity depending on what your role is in the organization. And I think that the power of building communities of people that are looking from the same perspective really speaks into a way that maybe just one singular focal point of the chief equity leader could not. I mean, I think we had a very insightful program on yesterday that was around trustees and governance. And so when you think about that community of individuals that are vital to the equity work, and so how do they talk about equity? What does the work that we do around diversifying our boards, having representation that are reflective of our communities, what does that do downstream in terms of informing our leadership composition, our workforce composition, and then how does that benefit equity? And so I think that when you have people who kind of look from the same lens, speak from the same language, that we're able to really have a better awareness and perspective. And I think that, for me, part of that community and learning from people that are in my role in terms of how they view equity, how they work towards advancing equity, and just how we learn from each other from a best practice perspective is very important. And I think that there's so much power in terms of the framework that you and Joy and others in the association are doing to create that type of community.
Yeah, we've also added to our Journey virtual community, which for those members like yourself who have taken the Health Equity Transformation Assessment and completed it, we wanted to create this space where there is sharing, where there is opportunity to look at best practices or promising practices, or even say, hey, these are some things I didn't do that well, and let's learn from some of our challenges, but we want people to take risk in this space. So those kind of professional networks around organizations seem to be just as valuable as those individual or personal networks for our own professional development as well.
Yes, I agree. And I think that what it also does is it kind of helps us to remove some of the stigma around the work that's going on, much like a long time ago, just in the search for quality. The first thing is that you have to have transparency. You have to have humility, because it's not about blame. It's not about shame in terms of not being where you want to be. But until that's acknowledged, you can't make true progress. And so I think that when we partner with others at other organizations that say, hey, this was a self-reflective exercise for us to look honestly where we are, acknowledging we're not going to be perfect. But as we did that, we began to advance the work and to make some strides. And so I do think that there's a part of that coming together as a community that allows us to have more humility in terms of how we look at the entire process.
Yeah, your hospitals too range. Can you tell me more about your hospitals? You're in a rural area to some extent,
So we're out of Athens, Georgia, is where our tertiary care facility is, which is more of a suburban community. And then we have two rural facilities, one being a critical access hospital to the southern part of our market, one being a 60-bed hospital in the northern part of our market. And those communities are different in terms of their size, in terms of service availability, in terms of offerings that the facilities have, as well as the term of the makeup of the community. So they're a little different. So as part of that, again, there are commonalities that we have around equity, but then there's some different challenges in terms of vulnerable populations in those communities. So 80% of our approach will be the same, but then there'll be some, about 20% of that approach that will be different.
Equity within equity.
Right, correct.
I want you to finish the sentence for us, Montez. I think it's a good one to close out with. Leading in general is tough, but leading through change is
very tough. Because I think that, anytime we have change, and I've looked at a lot of opportunity with that, it's just being aware of what is to come with the change. I mean, a lot of time there's this uninformed optimism that we have when we announce that we're going to go forward and we're going to make this change. And then as we begin to really learn about what's involved with that change and how heavy of a lift it can be, there now becomes this informed pessimism that starts to set in. And then as you continue to go down that process, you actually run into this place where the work is so tough that you begin to wonder, should we stay here, right? Okay, we're okay where we are, or should we continue to move forward? And then it's not until you begin to get some wins, to kind of see that ray of light, the hope now begins to really set in, and then you really can begin to make progress on making that change. And so it's really a cycle. And so I think that it's very tough to be able to manage, but it's necessary because we can't stay stagnant. That's not a path to prosperity, and definitely appreciate all of the work in the association. It's been evident in terms of the commitment to equity amongst our institutions, and that's been very refreshing this weekend to see.
That's awesome, and I want to thank you for being a change agent.
Yeah, thank you, and thank you so much for having me. Great conversation, and I appreciate the opportunity.
Thank you so much.
Thank you.